These are the battle plans. The battle plans are basically just all those different steps in action. And let me just find a good case here for you. Maybe we'll show you. Let's show you this one. This is a medial frontal AVM, and this is one of these cubes, which has all the anatomy mapped out. This is the surgeon's view, so you've got the head turned, you've got gravity that's opening up this interhemispheric fissure, and you're going down that fissure to see the AVM. The way I've drawn this, I'm actually going to show you a case where things are the opposite. This is when you're going in on the same side of the AVM and working it out of the frontal lobe. I'm going to show you a case where we actually flip that and go on the opposite side. So here it is. Notice from the MRI that the AVM extends greater than 2 centimeters off the midline beyond the interhemispheric fissure. And you'll notice there, got rid of that volume. So this is the case. You can see it's a medial frontal AVM. And our strategy for this is a bifrontal craniotomy, but we're going to go contralateral. And what I mean by that is the AVM's on the upside. It's farther away from us. And what we're doing here is we're going down that interhemispheric fissure, and I'm coming on the AVM now. You can see this abnormal vasculature. These are the arteries that feed into the AVM. And the idea is the hardest part of this dissection is to go around the lateral part. And I'm just going to jump ahead here. Here you're seeing it, but the hardest part is to go over the top and around the outside. So by putting the AVM on the upside and having it fall into view, it actually makes it easier for me to go around that deep portion of the AVM. And you'll see that later in the case. At this stage of the game, we're just kind of going around and interrupting some of these easy vessels that are right on that inside edge of the AVM. And you can see here, this is a large anterior cerebral artery, gives off these little branches to the AVM, and we just pick them off one by one. And as we do that, the AVM starts to lose its arterial supply. But now you see what's happening is I'm going over the top of this thing. I'm trying to get over and above it. And you see I'm going to go into a little bit of the brain over the top. And as I go in there, what you see is that this trajectory really helps. This is the edge of the AVM here, and we're going to go in right over the top. And because I'm kind of peering over the edge, you see how I'm able to see around the AVM. This is the border right in here. And it really helps me see into that plane, into that border. And this is a much more favorable way to see into that dark space. And you can see I'm going around the front of it. Now I'm going over the top of it.
Hi, Dr. Dr. Lawton. I'm sorry.
Here is where we're really getting into that lateral space. You see here, the AVM just wants to fall away from the brain into our, almost into the surgical corridor or into my lap. And it's helping me see the deeper I go. And that would not have been the case if we had put the AVM on the opposite side. So here's just more work getting around these things. Here's this big venous varix on the back. And you can see now, the deeper we go around this thing, it starts to turn a little blue. You see how the AVM is starting to look a little quiet? And here I'm seeing into this little space here on the lateral border, and gravity is helping me. It's actually pulling the AVM out of the frontal lobe just by the way that I've got things positioned here. And you can see we go deeper and deeper, and we've got to get all the way around to the deepest part. And you can see, if you look in this little space where I'm working, there's white matter of the deep frontal lobe. The AVM is peeling away, and I've got this lighted sucker that's helping me see into the hole. And you can see I'm right on the margin of the vascular tangle. So the blood vessels are on one side, the white matter's right on the other side, and we try and hug it as really tightly as we can to protect eloquence and protect the functional brain there. Hey everyone.
everyone, Ryan Rad here from neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.